Hey everyone, you're watching KTAL News Now. I'm your host Anthony Mocklin, and today is Wednesday. We're at the middle of the week. We are almost there, y'all. Just a few more days until the weekend. But for now, just stick with us for today's episode of Wellness Wednesday, where we'll be covering a variety of different local health topics and news, as well as tips for your lifestyle and how to live a better and healthier life. Our first topic, if you have been keeping up with us on KTAL News Now throughout the week, you'll know that on Monday during our weekend recap, we covered the mother of 3 who was wrongfully accused of child neglect. And if you were in a similar situation and needing family assistance, Volunteers for Youth Justice has resources available to families to prevent any situation like this from happening to anyone else. And NBC's Grace Jensen has more about the Volunteers for Youth Justice and what resources families can get that are in need.
The local nonprofit has what they call the Family Resource Center, which offers essential services to families across 10 parishes in Northwest Louisiana.
So many times families are triggered by trauma and stress, and sometimes stress can be as little as not having food in the home, or back to school is right around the corner, so school supplies and school uniforms are very expensive, and that's a stressor, which can be a trigger.
The 3 main services include parenting and life skill building to navigate the challenges that come with being a parent, providing assistance to family members who have taken on the role of caregiver for a child within their family, and My Community Cares, which offers targeted resources and support for families residing in 2 specific zip codes in Caddo Parish.
But the Harbor is a one-stop resource where we have a food pantry where we're able to serve every zip code in Caddo Parish. So there's always a way for families to get the resources that they need.
And to anyone who may be scared or embarrassed to ask for assistance, Person shares that is what they're there for.
There are people in this community that want to help, and Volunteers for Youth Justice is one of them. That is what we do all day, every day.
And if you're still looking for family care, Special Health Resources in Northeast Texas and Southern Arkansas also is making sure that families have access to affordable care. And some of their reps were actually in the studio and talked more about the services that they provide with NBC's Fernanda Hernandez.
Our mission is to make healthcare accessible. So we offer comprehensive, affordable healthcare for the whole family. And we offer everything from adult primary care to pediatrics and newborn, dental, mental health, behavioral health care. And we try to make it accessible for anyone who's needing access.
Yeah, and speaking of accessible, you guys have some mobile units. Cecile, that brings us to us. You are providing a really essential resource for women. Tell us a little bit about that.
Yes, ma'am. So right now we have this program. It's called WHOA. It's Women's Health on Wheels, and it's strictly, we focus in women's health. That's what we do. The services are pap smears, birth control, health screenings, everything that has to do with women's health, we'll take care of it in the mobile unit. As right now, we visit 3 counties in Texas. One of them is Cass County, which we go on Tuesdays. And then the next county, it's Red River, and we go on Wednesdays to Red River County. And then on Thursdays, we visit Panola County.
Okay.
We're there from 10 to 3 p.m.
Where exactly are you guys going to be at when you do visit those counties?
Okay, we go to different cities on those counties. With Cass County, we go to Atlanta, Texas, Linden, Texas, Hugh Springs, Texas. With Red River, we visit Clarksville, Texas, Detroit, Avery, Texas. And with Panola County, we stayed with the Carthage, which is the bigger city.
Yeah, we have a lot of viewers in those areas, so we really want women there to be able to access you guys. What an important service you guys are bringing to them. So if they do want to visit, do they just approach the mobile unit? How can they actually get care from you guys?
Yes, ma'am. They can just approach the mobile unit. They can also follow us in Facebook in the SHR Mobile Clinic, and we have calendars that with set locations that we visit monthly.
Perfect. Yeah. So again, a really great resource for everyone to take advantage of. Ashley, talk a little bit about the Texarkana Clinic. That is what's closest to us. You guys are offering lots of services there as well.
Yes, so our clinic is on the Texas side, but we serve both Texas and Arkansas, and we offer adult primary care there, dental, mental, and behavioral health. We also do STI testing and treatment and prevention, and then we have substance abuse programs where we can do counseling treatment, and then we also have a Suboxone program, which works specifically with people who are maybe facing opioid withdrawals.
And if you want to learn more about Special Health, you can visit their website at specialhealth.org, where you can find all of their clinic locations on their website, as well as the programs and services that they offer and what those entail, as well as who their providers are when providing care to patients. And if you're a person like me and you want to know exactly what type of service you're getting and what care you're getting, and if it falls under your insurance or if you don't have insurance, all of that information is readily available on their website. Again, that's specialhealth.org, and you can find all of that and more on their website. And having access to care is super essential in just making sure that you're healthy every single day and taking the necessary precautions to prevent any health complications, especially in the summertime, because it is so hot right now. I mean, we are reaching the triple digits now, especially this week in terms of temperatures. So please make sure that you are staying hydrated, because there's been such a surge in 911 calls around the area regarding people with heat exhaustion and even house fires in this just brutal, blistering heat. So please make sure to be careful. But in terms of the surge in 911 calls, NBC's Alicia Gatewood spoke with the Shreveport Fire Department to figure out why this is happening and how it can be prevented.
The Shreveport Fire Department says recent 911 calls have increased as temperatures reach triple digits.
Yes, we have seen an increase in fires and emergency calls.
Chief of Special Operations Calvin Baker Jr. says one of the most common 911 calls they're seeing is heat exhaustion.
We also had several heat exhaustion calls where, like I said, those who were working out in the hot temperatures where they need some assistance for the fire department.
Baker says no matter the job description, whether it's construction crews or others working outside, staying hydrated is key.
We do see a lot more emergencies where they're not probably adequately hydrated. We advise our guys to hydrate prior to coming to work and hydrate while you're at work.
He says SFD crews are rotating more frequently to prevent fatigue while responding to emergencies in the extreme heat.
We send some extra crews, some guys out there to help to rotate crews, so one crew is not doing all the work and getting an overload in the stress in this heat.
The department says if you experience dizziness or nausea, seek help immediately.
It is so important to stay hydrated, especially in the heat. I mean, I carry my water bottle around with me everywhere I go, essentially. I always try to drink a lot of water throughout the day just to make sure, even if I'm outside for whether it's a couple of minutes or an hour, like it can hit anybody at any time depending on how hot it is, and it is super, super hot right now. So just please stay hydrated throughout the day. It can be very crucial to preventing heat exhaustion. And if you have to work outside, be sure to bring, specific clothing to prevent against that, and to try to find shade as much as possible, take breaks when needed, and just keep drinking water throughout the day, because it is no joke. And another thing that is nothing to play with is breast cancer, and there is a Massachusetts company that is actually developing an AI model that can predict the chance of breast cancer development over the course of 5 years in women, which I find really fascinating. It not only prevents it from happening because of the detection model, but it charts out this 5-year pathway to see whether something has the potential to form over the course of 5 years. So it is very important that we are getting this early detection to prevent this and to take action as soon as possible. And Priscilla Casper has more about how that technology is actually being put into action in local hospitals and across the country.
1 in 8 women will be diagnosed with breast cancer in her lifetime, and 85% of women will have no family history.
For a country that spends $4.5 trillion a year on health care, most of that on detection and treatment, we're asking a question that I think is going to be the future of medicine.
The future is much more in focus with Clarity Breast, the first FDA-authorized AI platform that predicts a woman's 5-year future risk of developing breast cancer by analyzing her mammogram.
This is what my human eye, my radiologist-trained eye sees. Clarity Breast identifies patterns in the breast tissue that indicate future cancer risk. It's not looking for calcifications and masses and distortions. It's looking for patterns embedded in that mammogram that predict the woman's future risk of breast cancer. A heat map, as shown here, shows us where that computer vision model is focusing on.
How do you train AI to do this?
So we took millions of mammogram images from a diversity of patients and geographic locations. Our company has worked with amazing data partners in Europe, in South America, all across the US. So we leveraged the strength of those images to train the model through neural networks to learn patterns in mammograms in women who develop breast cancer in 5 years.
The risk score is from 0 to 100.
Our risk score does change because breast tissue changes with different impacts by the environment, by a woman's reproductive health, by her body mass index.
And once a woman knows her risk score, doctors can then intervene to help reduce it.
We plan to roll this out center by center. So there's 15,000 imaging centers across the United States. And step by step, we're going to work with as many of them as we can to bring this to women everywhere.
And like I said, y'all, it is no joke. Cancer is nothing to fool around with. It is a very serious and dangerous disease. I mean, I've had several family members deal with cancer, and one sadly lost his life to cancer. So it's very important that you can detect this early and get screenings regularly to find anything to catch it in an early stage so that the proper medical procedures and treatments can be provided to eradicate it as soon as possible. And it is so crucial. I can't stress that enough. But while we're on the topic of just wellness in general and physical health, another aspect that can greatly improve or affect your health is your nutrition and your diet. And the Greaux Healthy bus, which aims to target childhood obesity, is passing through Shreveport right now. It was here last week and will also make stops later this week on Thursday and Friday. And Mata Drain of NBC actually had the director of Greaux Healthy in the studio to talk more about their initiative and how you can be involved.
So at Pennington Biomedical Research Center, we've been doing research over the last 35 years around the prevention and treatment of childhood obesity. So we're excited to partner with the state to translate that research to bring resources to the communities.
Okay, sounds good. Now, I know a lot of people are wondering, what are some of those signs that, they need to be looking for in their children to, know that they may be obese?
So I think it's important that families as a whole work together to incorporate nutritious foods and physical activity, and then partner up with their healthcare team to learn more about the risk for childhood obesity.
All right, now today you're here handling business, but like I said, next week you will actually be here with your bus giving out some information. What can the public look forward to with the whole experience with you all?
Yeah, so we're really excited. Our Healthy Moves bus will be here next week. We'll be at the YMCA on Knight Street on Thursday, and we'll be at the Wonder Kids Clinic at Willis Knighton on Friday. And so with our Healthy Moves bus, we're going to be looking to share education and information with families, as well as enroll families in our Pennington Generation Research Study.
All right, now with the study, explain to us a little bit about, what's going on.
Sure. So we're looking for 1,500 families that we can learn more about health behaviors and lifestyles and how they may contribute or connect to obesity and other health outcomes. Family members can earn up to $50 a piece for participating in the study, and they'll receive lots of great information and education over the year.
Okay, now from my understanding, you already have launched this initiative in Baton Rouge. What has been some of the responses you've received so far?
So over the last year, we launched in about 30 different schools, providing them resources to advance school health programming in the school setting. We actually worked with the Caddo School District, and we're in 4 schools in Caddo Parish as well. We've partnered with early child care education centers, and now we're really looking forward to connect with healthcare providers and families directly in this next year.
And if you want more information about Grow Healthy, you can visit their website at growhealthy.org. That's GREAUX healthy.org. And you can see a map of their schedule in the upcoming year. While they're visiting Shreveport this month, starting in August, they'll be in the Monroe area, and then followed by the Alexandria region in September. They will be at the YMCA on Knight Street on Thursday in Shreveport, followed by the Willis Knighton Children's Clinic on Friday. You can catch them there on Thursday and Friday in Shreveport, like I said, but you can catch us on KTAL News Now every Monday through Friday at 1 p.m. You can visit all of our old episodes on YouTube at KTAL News, as well as the previous episodes from this week in the article on our website at ktalnews.com. As I said, you can catch us on KTAL News Now weekdays at 1 p.m. But for now, I'm Anthony Mocklin, and thank you for joining us.